Well, hello, y'all. So it's Kelly over here at Patient PT, and I'm here for Wellness Wednesday. Today's topic is health insurance, and we are going to be talking a little bit about the history of health insurance and um, sort of how health insurance practically affects modern healthcare and healthcare providers, and especially patients, because patients are sort of always at the center of these Wellness Wednesday training sessions that I do. So, I like to start off Wellness Wednesday just by giving a really brief overview of what's already been covered. So, Wellness Wednesday began life as a series that was called Wellness 101 and covered a lot of things like hydration and exercise and mental wellness and how all of those things fit together to form a true picture of wellness in a human being. And this series is called Healthcare Navigation 101. And in Healthcare Navigation 101, I'm talking about lots of different topics that sort of affect the complexity level of our modern healthcare system and can lead to some obstacles for folks that are trying to get help for various problems, but particularly as affects the musculoskeletal and nervous systems because that is what we movement experts in the world of physical therapy focus on the most. So, uh, in the first lecture, we talked about who's who, talked about different types of care providers and how they fit together as a system. A lot of that was devoted towards primary care and how primary care is ideally supposed to work, and then how it fits together with some of the alternative healthcare providers and supplemental healthcare providers like nurse practitioners and physician assistants and chiropractors and massage therapists and physical therapists. Um, then last week we did an overview called What is Health and did some talking about the factors that contribute to true health on a day to day basis and how our modern healthcare system is not necessarily the best fit for keeping people safe and healthy all the time, and how a little bit of a change in perspective or a different provider can make a big difference in a person's day to day health. And this week we are here to talk about health insurance, which is a topic that is pretty important. A lot of us really rely on our health insurance to ensure that we are getting at least our services paid for, and even that can be kind of controversial these days. And so I wanted to do a little bit of talking about how one can get around in the health insurance world and get past some of those obstacles, and perhaps give you guys a little bit of food for thought as far as how you can better take charge of your own health and wellness by advocating for yourself with the health insurance companies. So, um, I have an outline that is posted on patientphysicaltherapy.com. If you'd like to access that outline to follow along with this or any other Wellness Wednesday, all you have to do is go to patientphysicaltherapy.com, look for the menu at the upper right, and under About, you will find a link that says Blog. And if you just click the topic of the Wellness Wednesday today, it just says Healthcare Navigation 101 Insurance. And you click there, there will be a copy of the outline for the week's lecture. So, without further ado, let's jump into things. So, I wanted to start with kind of a brief history of health insurance. It's a brief history in part because health insurance has not always been such a large factor in health and wellness care. Uh, Health insurance wasn't considered, well, it wasn't around because it wasn't entirely necessary early on in healthcare. So, of course, medicine has evolved enormously over the years. And once upon a time, when you sat down with a doctor, a lot of what you were getting was lifestyle based advice and not so much medication, and surgery was used very much as a last resort. And one of the things that a lot of folks sort of find themselves dissatisfied with in today's healthcare system is that it can be, or it can seem at least, easier to get access to the prescription and surgical interventions and a little bit harder to find good advice when it comes to everyday wellness and preventative things. So, in the pre insurance era, it was a sort of lower cost system, and the vast majority of the cost was actually going towards paying the provider, the doctor themselves. So, professional time was the main source of expense. And then we started to have health insurance cropping up to pay for some of the more expensive aspects of healthcare, and it eventually came to dominate virtually all of the payment for healthcare. And one of the models that became really popular in the 1990s that really has contributed to our modern health insurance atmosphere is called the HMO model. HMO stands for Health Maintenance Organization, and that was an attempt by insurance companies to sort of duplicate the many solid principles of having a regular primary care provider, but also incorporate some of the expertise of various specialties, okay? But unfortunately, that meant that the HMOs had a lot of control over what providers you could go and see, what procedures could be approved, things like that. And there were a lot of levels of approvals required, and folks didn't necessarily have as much choice as far as what providers they were going to. It was kind of similar to what we deal with today, which is sort of more a PPO model, a preferred provider organization model. So that model emphasizes insurance companies contracting with specific healthcare providers. And they establish rates as part of their pre negotiations that the healthcare provider will be paid for various services. And after you've got a contract established with that insurance company, they will start to send you referrals. And so that is something that can be a big advantage as a healthcare provider. But one of the big disadvantages is that sometimes the payments that are negotiated are a little bit lower than you would ordinarily charge, or you just have a more of a limited access to different types of treatments. Okay, so for example, if you're the sort of provider who is in a field that's rapidly evolving, like for example, this whole COVID-19 pandemic that we're dealing with, that is a rapidly evolving situation. There are new treatments that have been coming out on a pretty regular basis ever since all of this started. And I think that that's probably causing already quite a few insurance nightmares for both patients and providers, because anytime there are treatments on the healthcare scene that are newer and less researched, that has a tendency to be a target of rejected claims in the insurance world. Okay. And so, really, that's kind of one of the things that characterizes our current model. This PPO based system that we are all working under gives you a lot greater choice in the types of providers that you are seeing, but there can be a lot of complications when it comes to payment. And so that's part of the reason that the primary care system has evolved into what it is, as we've talked about in some previous sessions in Healthcare Navigation 101. And sorry, my little speaker was just making a crazy noise in the background, totally distracted me. That's one of the reasons that primary care providers have been established, because they are trying to sort of help people keep track of all of the different things that may be going on in their health. And when you're younger and you don't have a whole lot of different health problems, that is a little bit less important, or it may seem a little bit less important, but especially as different health conditions accumulate over the years, or after you've had a surgery or two, every part of your history becomes a part of who you are as a patient to that provider. And those are all pieces that they need to kind of put together. So, as discussed in one of the previous healthcare navigation lectures, the primary care provider really kind of has a lot of pressure on them to have a holistic view of everything that's happening with their patients. And modern health systems don't necessarily make that easy on those primary care providers, because those payment contracts that are negotiated by the insurance companies a lot of times will mean that, for example, an individual procedure might ordinarily cost $60 or $100, and then the payment level negotiated with the insurance company might only be $35. Okay, so in order to make up for the loss in those individual payments, they have to see a higher volume of patients. And when you have to see a higher volume of patients, that's where you start to get more strain on the system, because the healthcare professionals really are drawing on a very complex body of information. And human beings are complex organisms, and so it can become very easy to miss things when you are focusing on these ancillary factors in a person's health plan, okay, that have nothing to do with whether or not they are more or less well or in more or less pain. So the current model is one that a lot of folks are really dissatisfied with, and I think that a lot of folks really don't know what to do in order to feel more empowered as patients in this current health insurance based model. A lot of folks' health insurance is tied to their job, or they're on Medicare or Medicaid, so it's tied to the government, and advocating for oneself under those circumstances can be really intimidating for a lot of different reasons, and that is not even mentioning the fact that it can just take a lot of time. It can also be really frustrating. And so, from a patient perspective, in this insurance based model, there can be a need to advocate for yourself just to make sure that your bills get paid. When I was going through my own healthcare journey and trying to get a diagnosis for my chronic pain condition that eventually was diagnosed as a B12 deficiency, which isn't actually a chronic pain condition, it's actually a systemic health condition. I went through a lot of different providers. And one of the last providers that I went to see before I finally got my diagnosis was another physical therapist. And I didn't even, at the time, connect it very firmly to the pain that I had been having in my lower right leg for about 4 or 5 years at that point, because I had started to have pain in the opposite knee. And I had been dancing at a wedding a few weeks before, and I felt a little pop when I twisted my knee a certain way. And it wasn't a big pop, and it didn't hurt that much, but it did feel weird. And then my knee swelled up a little the next day, but not very much. And basically, it just wasn't quite enough of an injury that I felt like I needed to go to an emergency room or an urgent care. And I was just in my first semester of physical therapy school at the time. So I thought, you know what? I am going to take advantage of direct access to physical therapists. I'm just going to go to this physical therapist that is like less than a mile away from campus while I'm in grad school. No problem. So there were some good things about that. Because I was seeing the physical therapist via direct access, and we had not updated our Practice Act to include a greater number of days for direct access. I only had 21 days to work with that physical therapist. So I was allotted about 3 weeks to get better before I had to go and get a prescription from a doctor. And in that 3 weeks, I went in to see my physical therapist 3 times a week and ended up doing some pretty intense workouts. Sometimes I was there for as long as an hour and a half. It seemed like every time I went in, they were adding more and more exercises and never taking them off. I don't think I ever, after my very first visit, got a printed copy of my home exercise program again, so I always felt a little fuzzy on exactly which exercises I should be doing at home. And I also was working with a physical therapist assistant every time I went in, as opposed to my physical therapist. And so when I would ask questions about updating my home exercise program or whether I could drop exercises, the answers were always kind of a little fuzzy. But by the time it was all over, my knee felt better, my pain was over, and so I was fairly satisfied with my experience. A month passed by, and then I started to get bills. And I just kept getting bills. And the first bill was not insubstantial. I think the first bill that I got was around $200, and it showed all kinds of different charges on there. I couldn't even really make much sense of what was what. But, my knee was better. The care I didn't really have any major complaints about, so I paid the bill. And then I got another bill and another bill. And by the time it was over, I had ended up paying over $600 out of pocket. And it was just for 3 weeks of therapy. And I didn't get my last bill until over 6 months after that plan of care was finished. Okay. Keeping track of which bills had been paid, which ones hadn't, I am still positive to this day that if I had made some more phone calls, if I hadn't been so busy with grad school, I probably would have been able to get at least a couple of those bills just wiped out because I think at least one of them was a duplicate. And that kind of thing happens all the time in the world of medical insurance billing. And it's a huge point of frustration for patients because essentially it amounts to hidden costs. I don't know if any of you have ever attempted to figure out how much a episode of medical care was going to cost you out of pocket with your insurance or without, honestly, before you actually had those services performed. But healthcare, of course, is one of the only professions in existence where the services are rendered and then they figure out how much it's going to cost after the fact. And that is really why a lot of times you can't figure out easily, anyway, even a ballpark estimate of how much something is going to cost until well after the fact. Partly it is a matter of complexity, okay? Partly it's because every individual provider has a different contract that's been negotiated with the health insurance provider, and so you can't really like get an estimate from one and assume that it's going to be anything close to what the estimate for a different provider in the same genre of healthcare would give you, okay? But a lot of it is also that the provider themselves can't know for sure exactly what they're going to be billing for until after the care has already taken place. So I don't necessarily know whenever I first am working with a physical therapy client or patient whether or not we're going to end up like working on a really long-term pain problem. Sometimes folks will start out like working on a low back issue, but it turns out that the problem is with their hip, or a lot of times people will have pain in their knee and it turns out that it's their hip or their low back that's actually causing the problem. And so after the fact, after you are finished working with a patient, you have to go back and do all of your paperwork. And that's the point where you apply what are called billing codes, okay? So in physical therapy, just as an example, there are billing codes like therapeutic activity, therapeutic exercise, manual therapy. And the differences between those things are sometimes quite subtle, and a lot of times they are up to one's professional judgment. Okay, so for example, the difference between therapeutic exercise and therapeutic activity is to some extent up to my own professional judgment. Now, therapeutic exercise is, usually more resistance training and exercises that are strengthening a specific part that needs a little bit more support, whereas therapeutic activities are usually things that you need to do in order to go about your day-to-day life, but which are not necessarily exercise. So that could be things like if you have difficulty getting out of bed because your back hurts or something like that. If we did some targeted training on exactly how to get out of bed to minimize your amount of pain, that would be considered a therapeutic activity instead of a therapeutic exercise. But that's up to me if I'm working with an insurance company, okay? And here at Patient PT, I actually don't do insurance billing. It's all direct pay, and you can use a health savings account to pay for your services here at Patient PT, but those are not subject to the same level of scrutiny that individual medical claims are subjected to, because at the end of the day, even though I'm not going to say that health insurance companies are, out to get patients or like cost people more or cause providers to get paid less or anything like that. There are all kinds of accusations that go around and emotions get high. But at the end of the day, they have to minimize their costs just like anything else in a capitalist system, okay? And though it may not seem appropriate to all of us, our healthcare system is operating within capitalism. It is a capitalism based system. You have to pay for services. And the closest that you get to not having to deal with that on a really scrutinized level is when you are in a hospital, okay? Because a lot of times people's plans of care are complex enough that things like physical therapy services or speech or any other sort of therapeutic services are sort of rolled into some of the costs of putting somebody in a inpatient environment like a hospital for a certain period of days. And again, that's something that varies with every hospital system because they are negotiating those things too. But from a provider perspective, they may have a little bit more flexibility. And that's actually what drives a lot of healthcare providers, especially physicians and physical therapists, into inpatient environments because you are, at least to some extent, insulated from the effects of all of these health insurance billing quagmires that folks find themselves in. You're not entirely insulated from those things, especially if you are a higher level provider like a surgeon. There are a lot of times that surgeons will actually have to get on the phone and advocate for their patients themselves if claims are denied. And all of those things add up to more complexity, more complex paper requirements, and generally a need for advocacy on the part of the healthcare provider as well as the patient. Um, any system in which there are multiple layers of bureaucracy, like a health insurance system or a government sponsored health payer model, like Medicare or Medicaid, there are going to be multiple layers of bureaucracy that you have to sort of fight your way through. And anytime there are multiple levels of complications, there are always people who get left behind. And so, all of those things are sort of the reasons that come together for me to decide as a provider, I don't really have any interest in, at this time, billing insurance. I could hire somebody to bill insurance for me and handle a lot of those things for me, but that would substantially add to my overhead, the costs of running my business. And one of the only reasons that Patient PT has been able to survive, despite being less than a year old when COVID 19 hit the United States and shut everything down for such a long time, despite the fact that I have a non-profit focused model, despite the fact that my focus is really on providing the best care possible for my patients. That health insurance billing, the need to either pay somebody to bill my insurance or to constantly be revisiting my claims to make sure that they get paid, or to wait 3 months, sometimes 4 months, to get payment for services already rendered. Those are the sorts of things that kill small businesses like mine. And so, at least so far, I don't have any regrets about my decision to not bill insurance for my services, because at the end of the day, it means that I and my patient are the ones who are making the decisions about what is best for them. And it doesn't matter if I'm seeing somebody via direct access for physical therapy and I'll probably only end up working with them for a few weeks or maybe a month, or if I'm seeing them for ongoing wellness care, which are a lot of the folks who come in to see me. They want to have somebody with a medical background to discuss their labs with in a little bit more detail, and ask those kind of stupid questions that everybody forgets to ask when they're sitting in a doctor's office, okay? Especially if you're in a situation where you've had to be waiting in a waiting room for a long period of time before your visit actually starts, or you've had to wait 4 and 5 months just to get in for that office visit to begin with. It can be really easy to lose a lot of those really detailed points and detailed questions. And having somebody that you can consult on a more regular basis on shorter notice. I have same and next day visits available almost every day at Patient PT, and most physical therapists have visits available within a week via telehealth and virtual now. Again, thanks to COVID 19, most of us have virtual care services of some type available. And so, for me and for a lot of healthcare providers, more and more every day, health insurance is just not as worth it to accept as you would think. And particularly for someone like a physical therapist who happens to be dual licensed as a massage therapist like I am, there are a lot of services that I can provide that are non invasive, very unlikely to injure anybody. And so those wellness services are really a huge value add for a lot of people. But one of the things that I think a lot of people don't understand is that health insurance is not wellness insurance. So that's actually why I decided to title this presentation Health Insurance, okay? So health is not guaranteed via health insurance. Wellness is absolutely not guaranteed via health insurance. As I discussed a little bit earlier, the health insurance model really came up in order to address the changing landscape of medicine and the more expensive interventions that we have developed over the years. So, developing a pharmaceutical intervention is extremely expensive. Developing a surgical intervention is incredibly expensive, and actually having the equipment to safely perform a surgical intervention is very expensive. So, that's where health insurance came in. It wasn't to cover a visit where you are just sitting and talking to your healthcare provider about how you can get more exercise in, or strategies to make sure that you're getting enough water water every day, or some of these more basic things that not all of us are so great at. As a matter of fact, a lot of us are really bad at those things these days. We don't really know how to incorporate them into our lives. And we're going to physicians and increasingly dissatisfied with our health care because we're not necessarily feeling better. A lot of us even go into those physicians' offices knowing that we absolutely do not want a pill or a surgery in order to address this problem, but not really realizing that that physician or physician's assistant or nurse practitioner is not necessarily all that well equipped to give you that solution. And a better result might have been attained from going directly to a totally different kind of healthcare provider, like a physical therapist, for example. So, to get back to medical insurance versus wellness insurance, okay? Medical insurance is absolutely intended to cover all of these catastrophic fees. And medical care is more expensive in the United States than almost anywhere else in the world. It's more expensive than it's ever been. And so health insurance is something that, at least for now, we all need in order to cover those catastrophic medical expenses. However, it's gotten to a point where folks are expecting health insurance to pay for every aspect of their health care. And while it may cover all of their health care, it's not necessarily going to cover their wellness care. And wellness care is something that is not covered really by most insurance plans. There are some insurance companies that are starting to incorporate more preventative and wellness based strategies and kind of incentivize them among their payers because they know, or not among their payers, among the patients that are taking, that are their patrons for health insurance. They are realizing that it does improve their bottom line and reduce the need for more complex and expensive services later on if they push for preventative and maintenance based services. But there are all sorts of payment codes inside the health insurance system and Medicare and Medicaid that are related to wellness that are not covered almost no matter who provides them. And one of the things that is both sort of a limiter and a source of flexibility in physical therapy is that global wellness, preventative wellness measures, are something that we are generally not reimbursed for. We have to be doing therapeutic exercise, therapeutic activity, manual therapy, so that hands on stuff, in order to make sure the insurance companies are going to pay us. And there are a lot of hoops to go through in order to make sure that those payments are made. And so even physical therapists who may have a lot of excellent feedback for you on how to improve your training regimen, how to make sure that you don't injure yourself while you're getting ready for that marathon, how to make sure you don't injure yourself while you're just sitting at a desk, or maybe you're at a new home office that is hurting your back all the time. Your physician is not really the person that you want to go to for those kinds of problems, and your physical therapist is rapidly getting sucked into the medical world far enough that our services are always covered by health insurance, and so we are always having to tie a person's episode of care to things like a specific injury, a documentable objective value. And it could be that the main reason that a person is seeking health advice or wellness advice is just because they want to feel better or they want to age more gracefully. And so I say all of that to say that there is not really any such thing as wellness insurance. And I think that that is one of the huge misunderstandings that is resulting in folks not getting the kind of medical care that they really need and deserve and want. Wellness and medicine are two different things. And a lot of times, medicine and wellness don't really work super well together. It's all about that cycle of wellness that I've been touching back on in each of these sections. Okay, like in an ideal world, you're going to stay over here at this end of the spectrum where you are just doing preventative measures, like making sure that you get exercise and eat a relatively healthy diet and stuff like that, to keep yourself healthy, to keep your body sort of functioning at optimal, and maintenance, so that if you do have an injury or something that's gone wrong over the years, started to cause you pain, whatever, you can continue to maintain whatever progress that you make on it. And that, again, a lot of times it is about exercise and hydration and things like that that you just have to do every day, that you have to learn how to incorporate into your life, but that a physician with literally sometimes 35 patients on their roster for a single day is not going to have time to coach you through. Okay, so that is where things like health savings accounts and flexible spending accounts can help somewhat. Flexible spending accounts are a little bit less flexible, ironically, but health savings accounts, a lot of times you can use them to pay for a variety of wellness services, including things like even memberships to gym or personal trainers or massage therapy services under some circumstances. And here at Patient PT, because I am dual licensed as both a physical therapist and a massage therapist, I can accept health savings accounts for virtually all services, just the same as I would for a regular credit card or a check, which I also take those. So ideally, you're going to be staying more at that prevention and maintenance spectrum of things and be able to stay away from the rehabilitation and medical side of that spectrum and not have as much of a need for catastrophic medical insurance, okay? And things happen, pre-existing conditions exist. People have genetic disorders. There will always be a need for some form of medical coverage, whether that is coming from a government entity or an employer. I think that things are probably going to be evolving a lot as a result of COVID-19 over the next several years. And so I'm hoping that health insurance is one of those things that absolutely gets reformed. But keep in mind that if you are not satisfied with the health care that you've been getting, if you want to focus more on things that you can do proactively yourself in order to make yourself feel better on a day to day basis, and especially if the things that you are trying to work on are day to day aches and pains, if you've ever wondered if such and such is happening because you're too old or too fat or because you're just out of shape or something like that, that is absolutely something that you can probably recover from. That's something that a physical therapist can help you with. That's something that you should be proactive about because the human body is really an amazing thing. We have an amazing ability to heal ourselves and to send resources to the areas that need the most repair. And if you understand how your body works really well and how your health insurance works, you absolutely can take charge of your health and wellness more than you ever would have suspected. But more than anything, it requires knowing what you're dealing with and what the limitations are, and just getting a few tips and tricks along the way. And, when it comes to health insurance, there is virtually nothing that you can do that will be more effective than making a phone call, okay? And sometimes you have to make that phone call over and over and over again. But one of the things that happened in recent healthcare reform, so when the Affordable Care Act, also known as Obamacare, went into effect, one of the provisions of that that was really a positive step for a lot of health insurance driven providers like physical therapists and physicians, excuse me, was the 80-20 rule, where health insurance providers have to spend 80% of the incoming money on actual provision of healthcare services and not on administration. And basically, what that means is they have to spend more money healing people and trying to heal people than trying to prevent paying claims. And so that all by itself really made a huge difference in both a provider and a patient's ability to advocate for themselves or advocate for a patient, because those administrators no longer have kind of an unlimited time to spend on the phone fighting claims. Not that that was necessarily what was going on, but that probably did happen at least some of the time. If you have the time and the persistence and the wherewithal to fight an unjust medical bill long enough, hard enough, they are far more likely to realize that it's costing them more to fight it than it costs to pay it. And so don't hesitate to call your insurance companies, hold them to account, make sure that you know what's going on with those unpaid bills. Providers like me who don't bill insurance themselves, almost all of us will provide what's called a super bill, which is basically an invoice that shows the different billing codes that we would have been billing under if we had been billing insurance. And then you can take that invoice and use it to seek reimbursement from your insurance provider. But a lot of times those are exactly the sorts of things that you need to follow up on again and again. Okay, so not all of us have the luxury of time to chase those things down, and that's just another reason that I personally have chosen to forego billing insurance here at my clinic. I don't think that I have that kind of time to spend on things, and I think that most folks would rather just know what it's going to cost them right up front. So that's why I just have all of my pricing listed on my website and available for anybody to see. You're never going to walk out of here having no idea what you owe me, because I won't let you walk out of here owing me money. And if you can't afford physical therapy, but you would like to give patient PT a try, I also wanted to mention that I do still have my Pain Map program, which is a pro bono program I offer for folks who have persistent pain conditions. If you have a pain condition that has been plaguing you for 3 months or longer, that is considered a persistent pain condition, and it might be something that I can help you out with. I have a really great track record with folks who have long-term pain conditions. I love to get to the bottom of them and figure out exactly what is causing that issue. So keep in mind that even though it may seem pretty bougie to pay for physical therapy out of pocket, I do have that pro bono program available, because one of my primary objectives here at Patient PT is to help the most people at the lowest cost that I possibly can. That's just another reason that I say that Patient PT gives better results in fewer visits, and there is, as always, no insurance or referral required to come in and see me. I have telehealth visits available, and if you'd like to schedule one, all you have to do is call, text. There's a contact form on patientphysicaltherapy.com, so feel free to check that out if you'd like. Next week, I am going to be diving deep on patient advocacy here at Wellness Wednesday. So I'm going to be talking a little bit more about the process of advocating for yourself, both in a physician or other care provider's office, to make sure that you understand what you are trying to get out of an episode of care before you go in, and that they understand what your goals are so that they can really work towards those, as opposed to whatever they may think your goals are, or a more typical set of goals are. Then also advocating for yourself with these insurance companies to make sure that your bills get paid, and other forms of patient advocacy. Really, how do we get better health outcomes and maintain true wellness? Okay. At the end of the day, sometimes you have to advocate for yourself with yourself. Sometimes it just means admitting to yourself that you are human and you need to dedicate a little bit more time, take things a little bit easier on yourself. That's something that I end up working with my patients on a lot of times. It's just not letting that stress and pressure get to them so much. So there are all kinds of aspects of patient advocacy that we can talk about and that are important and that I see causing people problems in their healthcare all the time. So that's what we're going to be talking about next week on Wellness Wednesday. I think that may end up being the last training in this particular series, but I am not positive yet. So we will see by the time next week comes around. I may have thought of another topic that I've always wanted to do a deep dive on in the area of healthcare navigation. But in the meantime, I've had miserable luck actually communicating to folks live on these things. This hasn't been nearly as much of a discussion group as it once was when it was in person. So I wanted to let you all know that you can also send me an email, patientphysicaltherapy@gmail.com. You can send me a message on Facebook, or you can leave a comment on that blog on patientphysicaltherapy.com with your questions, and I will start trying to address those at the beginning of future Wellness Wednesdays. So that's all I've got for you today, and I will see you next week. That should be the 2nd of September for the next Wellness Wednesday. Bye-bye.